My name's Chris Welsh. I'm the Independent Review Director of the Hospital Services Review for South Yorkshire and Bassetlaw. What we've been doing over the last 10 months is working with public, with clinicians and with all the provider organisations of acute services in South Yorkshire and Bassetlaw, looking how hospital services might be made sustainable into the future. Our report was published, but it's a milestone in a much longer journey for the hospitals of South Yorkshire and Bassetlaw. So our principal recommendation is, the first thing is that the hospitals of South Yorkshire and Bassetlaw need to work together. The second thing is that there should be a hospital in each of the places of South Yorkshire and Bassetlaw as there is now. And the third thing, and possibly the most important thing from the public's point of view, is that for most patients, they should continue to receive most of their hospital care in their local hospital. And we're recommending that the 6 emergency departments of South Yorkshire and Bassetlaw, that's Barnsley, Bassetlaw, Doncaster, Rotherham, Sheffield Children's and Sheffield Teaching Hospital, should continue as consultant-led emergency departments. So in children's services, the first thing is that, once again, the services in South Yorkshire and Bassetlaw need to work together across the patch. That's the first thing. But with regards to children's services, it may be that in the future there needs to be a reduction in the number of longer stay inpatient paediatric departments across the patch. Maternity services and children's services are intimately linked. The big challenge in maternity services are a combination of a relative shortage of obstetricians, but also a significant number of midwives in South Yorkshire and Bassetlaw will retire over the next 5 years. So there could be an obstetrician and a midwife shortage. But further work is required there. But what we must do is ensure that the service in South Yorkshire and Bassetlaw uses the advice provided in the national report, Better Births, so that there is the availability of babies being born at home, in the community, in midwife-led units, and if necessary, if they're high-risk births, in a consultant-led obstetric unit. What we're recommending there is that over weekends and out of hours, treatment for gastrointestinal bleeding is focused on 3 or 4 sites across South Yorkshire and Bassetlaw. This is an independent report based on evidence that we've gathered over the last 10 months, as I've already said, from clinicians, from public and from the data. Not everybody will agree with everything, but the central plank of our report is that hospitals need to work together to sustain the services over the next 5 to 10 years. We have a conundrum that the health service in South Yorkshire and Bassetlaw has a very significant number of vacancies, but at the same time we have a population of young people between 18 and 25 who are not in education, they're not in employment, they're not in training, and this is a golden opportunity that this institute could encourage them to work in the health and care services of South Yorkshire and Bassetlaw. So an innovation hub would help in looking at a problem and seeing what is available to help solve that problem. At the moment, a lot of innovation is the other way around. We start with a new gizmo and someone says, well, what can this gizmo do? And we're actually benefiting the gizmo rather than the problem. What I'd like to see is a number of what I will call hosted networks for clinical services. So a hosted network for urgent and emergency care, a hosted network for paediatrics, and a hosted network for maternity services, etc. And a hosted network is essentially a network of the organisations and the staff in them across South Yorkshire and Bassetlaw, but it's not a loose network. This is a network which is organised and driven by one of the hospitals in South Yorkshire and Bassetlaw, and that it has governance, it has accountability, and it has teeth when it comes up with a problem that is difficult to solve.